Dr. Joren. Awesome. So I'm going to be evaluating your spine today from about the base of your neck to about your belt line. I'm going to need to expose the skin in that area. Would you mind removing your shirt?
Okay.
Okay, so. Alright, so if I could have you sit here facing that wall. Alright, first I'm going to evaluate the SI joints. That one feels good. And that one feels a little restricted. So if I could have you lay face down on the table. So first I'm going to assess flexion. So I'm going to find the PSIS, and I'm going to have my fingers in the joint line, the PSIS and the sacrum. And then I'm going to have my other hand on the ASIS, and or AS, whatever. Yeah, so I'm going to palpate posteriorly, and I feel the pelvis glide, or the ilium glide past the sacrum. So then I'm going to assess extension. So I'm going to put my hands or my fingers back in the joint line. And for extension, I do not feel the ilium past or glide past the sacrum. So we have an extension issue. So that means that we have an extension issue with the left SI. So if I could have you go ahead and sit up again. Go ahead and sit down facing that wall. So then I'll continue with the general scan. Alright, so right in here. Alright, so I'm going to go ahead and have you bend forward. And then back down. Bend forward one more time. And back up. Alright, so I feel it right here. This should be about 7. So T7. I feel T7, so what I'm going to do is I'm going to have my thumb on T7, spine on T8. If I could have you go ahead and cross your arms. So I'm going to check rotation first. So I'm going to bring them into left rotation, spring through the joint. Go ahead and bring them into right rotation, spring through the joint. So out of left and right rotation, I did not feel the spinuses pass by or separate, and whenever I sprung through, I did not feel any resilience. So then I'm going to go ahead and check flexion. Since I'm on the right, I'll go ahead and check right flexion, lateral flexion, and then I'm going to spring through the joint. And then I'm going to go ahead and assess left lateral flexion. And see there on left lateral flexion, I did feel the spinuses separate or like close down on one another, but I did not feel it on the right side. So we have a right lateral flexion issue. So we've got a left spinous and a right lateral flexion issue. That's going to be a right, left. That's going to be a PLI. And then I'll go ahead and check the ribs. So if I could have you drop your arms. And then on 7, I'm just going to go up 2 spinous spaces, 2 interspinous spaces, so 1 and 2. And I'm going to go over 2 inches. And I'm going to have you take a deep breath in and out. Okay. So I found the superior aspect of the T7 rib. So if I could go ahead and have you cross your arms again. So I'm going to check, first I'm going to check extension or depression. So I'm going to bring the patient into extension and away towards the right, and then I'm going to palpate inferiorly, and I did feel the rib depress. Then I'm going to go for elevation. I'm going to come down to the inferior aspect of that rib, and then I'm going to bring the patient into flexion and bring them to the left, and then I'm going to palpate superiorly on that rib. And I did not feel elevation on the right side. So then for the left, come straight across. I might have you take a deep breath in. Alright. Now I'm going to go again on the superior aspect of that rib. bring the patient into extension and towards me, and then depress, and I do feel depression. Then I'm going to come up on the inferior aspect of that rib, and I'm going to bring them away and towards me, and then superiorly, and I do feel elevation. So then I will continue. You can go ahead and drop your arms. Continue with my evaluation. Going up. Nothing feels warranted for evaluation. Go into the cervical region. Nothing here feels like it needs warranted, so we're going to go ahead and check the atlas. So what I'm going to have the patient do is close your eyes and go ahead and bob your head up and down until, oh, let's just keep going. And then whenever you feel comfortable, stop, and then I want you to leave your head in a neutral position, what you feel is normal. So it feels, or it looks like it's superior, so we're going to say it's an AS. So found it was superior, now we need to check lateral flexion. So I'm going to come up here and find the transverse processes. And I'm going to go ahead and come up underneath to the inferior aspect of the transverse processes, and I'm going to bring them into lateral flexion. Left lateral flexion feels restricted compared to the right lateral flexion. Right lateral flexion closes, but left does not. So we have an ASL, and then I need to go ahead and check rotation. So on those transverse processes, come the posterior aspect again, bring into rotation, spring through, the right feels fine. Right rotation though, I feel restriction. So I feel, with right rotation, I feel an AS, it was AS, L, and then right restriction, so it's going to be an AS, LP. And that completes the evaluation of this patient.